Welcome to Bunny Hugs and Mental Health, the podcast that deals with all things mental health. We talk to professionals, survivors, and loved ones about their sometimes informative, sometimes uplifting, and sometimes tragic stories. I'm your host of the show, Todd Rennebaum, advocate, recovering addict, experienced sufferer of depression and anxiety, and author of the children's book, Sometimes Daddy Cries. Hello, and thank you for listening to another episode of Bunny Hugs and Mental Health. I am your host, Todd Rennebaum. What another wonderful episode I have for you this week with my friend Angela. But before I talk about that, I'd like to discuss a little bit about next week's episode with my guest, Donna. Donna is the mother of a young lady named Gia, and Gia took her life a few years back. I think it was 2013. Gia was on a few television shows, mainly The Bachelor, and she was also on a couple of the spin-off shows that The Bachelor has. So Donna and I talk about Gia, talk about some of the causes and some of the mental health issues Gia had growing up, and some of the mental health issues that Donna had as well. Mainly, we talk about PMDD, which is premenstrual dysphoric disorder, which affects many women, many undiagnosed or misdiagnosed. So stay tuned for that one. If you want to leave any questions or comments or concerns about any of the episodes, you can leave a message on my Instagram, which is Bunny Hugs Podcast. You can also go on to my Facebook, which is Bunny Hugs and Mental Health Podcast. You can go on Twitter, which is Bunny Hugs and Mental Health. And you can go on TikTok, which is Bunny Hugs Podcast. You can also go on to Apple Podcasts and leave a review, which is a nice comment, a nice way to do that. That's always very helpful for podcasters, and while you're there, you can also rate the podcast. Now, this week, I'm speaking with Angela, and Angela and I talk about BFRB Awareness Week, which is October 1st to 7th, and BFRB is body-focused repetitive behaviors, things like hair pulling, skin picking, nose picking, thumb sucking, so on. Donna is a huge advocate of BFRBs. She was even on the television show The Doctors, and that's actually where she really started to find professionals that were able to help her recover. You can find her on Instagram at Angela Hartlin and at Skin Picking Support. So follow those accounts if you can relate, or if you have a loved one that you think can relate, and maybe you'll learn something and get some good information following those accounts. Well, now, without further ado, I give you Angela.
Well, I didn't even know that it was anxiety when I was little. It's just kind of just a natural state of mind. I was just always very observant, very on my toes, very intelligent, always got like perfect grades. And I just noticed that I was a little more sensitive than a lot of other people, and I didn't really connect with people socially. I'd have maybe like one or two good friends, like every year of school. I did get bullied for my appearance because my picking kind of started when I think back, it's like grade 1-ish, because there was a bit of a I remember my mom, she, of course, nobody knows that this is a disorder or anything like that, but she wanted us to just use this cream on our face to avoid ever getting acne, but I was in grade 1 at that point. It kind of instilled a bit of an importance of having clear skin. And I mean, she would pick mine and my sister's pimples once in a while on our back and our face. So it was kind of like a behavior that, oh, this is normal. But actually, I mean, the reality of body-focused repetitive behaviors is that it is normal to take out, to pop a pimple here and there, maybe pull out a stray hair, something out of place. But when it becomes chronic and repetitive and compulsive, it really becomes a beast of its own. So I kind of always felt like just weird and ugly growing up, and my picking kind of extended by the time I was in grade 5 to not just my face, but it was my upper chest and shoulders and back. And I wore, in my grade 5 and 6 pictures, I even wore this ugly old turtleneck from the 90s, and it was just because of how much I was hiding. And I even had wispy bangs at that point to try to hide a little bit of my forehead. But in between those two pictures, something really life-changing happened to me. My father, who I had an amazing relationship with, had a blood clot to the brain. He survived, but it he needed a piece of his brain removed, and he didn't really recover. He recovered better than they thought he was going to, but he has limitations in his speech and some cognitive abilities. The right side of his body is the right arm is paralyzed. His right leg is he's able to move it a bit with a brace just to walk, and but he never really fully recovered. So everything, the dynamic in my family had shifted at that time, from my mom becoming a caregiver to a preteen and a teen, and all of a sudden a husband in the hospital and having to deal with that, and the coma and ICU and a lot of traumatic things like that. So my picking did kind of get worse, but I didn't really notice it getting worse until grade 8, surprisingly. Like, I didn't notice a huge shift when that happened. At the time, I was still picking and still covering and hiding, but it kind of traveled, I guess, in some sense, traveled. In grade 7, I remember sitting in gym class, and I wasn't interested in gym class. I didn't care, and it was like they were talking about it was some kind of like basketball or soccer. We were sitting in front of the chalkboard, and I looked down at my legs, which were completely smooth, and I saw this bump on my leg. Like, I still remember it too. And as I was sitting there in the gym, I looked at it and I picked it, and there was this long hair that came out, and it was squiggly. And the relief I got from that, like, wow, I got something out of my body that shouldn't be there, or, it wasn't perfect, or could have gotten bigger, and all these different things that now when I'm talking, now that I've been in recovery and gone through therapy, proper therapy, I'm just like, I know these are cognitive distortions. So it's hard to kind of relay them back because I want to fix them as I'm saying them. So by then, and it really kind of like triggered something for me to start picking at my legs. Like, and of course, that was about the time where I just started shaving, well, a couple years before. So there's like ingrown hairs, and then I became completely fixated on it. And the long story short, I tried to get help over the years. I started covering my legs from the age of 13 or 14 indefinitely until I got help when I was 28, after I was contacted by the television show The Doctors in America to appear on it in 2015, and they invited an expert on named Karen Pickett, and we went through 12 weeks of therapy.
Her last name is Pickett?
Yeah, she understands the irony.
Okay.
Yeah.
Okay.
And especially it's even, it's just, yeah, I've had that a few times. It just makes it not sound so real. Pickett.
Okay.
But she is like one of the experts in the field, so I was really lucky. And I mean, my excoriation disorder, which is compulsive skin picking, isn't perfect now, but it is so much better than it was. At its absolute worst in my early 20s, which is like 5, 6 years. No, about 8 years before I got help was when I was at my absolute worst. Like 20, I remember there was one night in particular, I stayed up from 11 p.m. to 7 a.m. when I gave my diabetic cat his needle in the morning. And I was just picking from face to like my ankles, just, and then of course things would resettle and I would start again up at my face, checking everything else, popping more things, pulling things out, scratching at things. And I at that point, like, I had dropped out of university. I certainly wasn't dating, because at this point anything before 2010 pretty much didn't exist. There was the Trichotillomania Learning Center, which is now TLC Foundation for BFRBs, and they changed their name to focus on all body focused repetitive behaviors instead of just trichotillomania, which was the kind of core focus before. So there was really no resources before 2000. 2010, but it was December of 2009 that I released my memoir, Forever Marked, a Dermatillomania Diary, because I just finally came out. And I came out because I felt like I really had no choice anymore because I was just hiding so much. I had quit university, I didn't date, I couldn't work. I mean, it would interfere, picking and hiding its aftermath would interfere with me wanting to go anywhere and wanting to be seen and having strangers make comments, and it was just overwhelming. Like, when I worked in the service industry, I had people come up to me and make like unsolicited advice about my face, and you would be pretty if type comments. And it really would, when I tried to hide it at the time too, it really broke me, because I'm trying to, when you're a teenager, you're just trying to fit in. You're trying to just be accepted and move forward with life. And unfortunately, those things really held me back. And it did bring me to a dark place when I was 18 and in my first year of university. I was working a lot of hours at a call center, and a lot of things had happened, and I did try to end my life. And I wasn't really hospitalized for a long time. I had like some very brief hospital stints. No one ever took my skin picking like serious, but they also didn't know what to do, as they still don't know what to do. To my knowledge, there's only 5 providers that are trained to deal specifically with BFRBs in Canada, and none of them are east of Ontario. I mean, I hope the list has updated. I haven't looked at it in the last, like, since the pandemic, I'd say maybe the last time I looked at it, but there were still only 5 at that time. And I think it was like a couple in Alberta and a couple in Ontario,
And you're on the East Coast.
Nova Scotia.
So there's nothing near you. Closest one near you was Ontario.
Yeah. So, I mean, I never really had it. But I mean, of course, everyone, all the mental health professionals say, yes, we can help you. We can, but there's a lot of things that they don't understand about the condition, like especially a lot of I think the mindfulness component and sensory issues related to skin picking that is often overlooked in, like, there's a model by Charles S. Mansueto, Dr. Charles Mansueto, called the SCAMP model, and it's from the Comb B model, but it's the Comb B model, but there's an acronym called SCAMP, and it's all the different things. I don't know them right now: sensory, cognitive, maybe affective, mind. Maybe M is mindfulness, and P I really don't know right now. But he has devised like a training program where professionals can get their accredited training, people who are already therapists. And for years, I've been wanting to try to make a difference in getting professionals interested in getting this training, because there's so many people in the world that are suffering with these shameful and embarrassing disorders, and they're extremely isolating. And the amount of discrimination that a person can go through living with this is extreme, especially now. I see in the forums people talking about being accused of having monkeypox, people being turned away from events because they look like they have monkeypox, and it's just really sad.
Mm-hmm. What is BFRB? What does that stand for?
BFRB stands for Body Focused Repetitive Behaviors,
Okay.
and that's an umbrella term for a bunch of behaviors that causes damage to oneself through repetitive behaviors. So whether it's picking, pulling, there's a whole bunch of things. There's a lot of oral BFRBs as well, like tongue biting, cheek biting, lip sucking, even like common things. A lot of us know someone with BFRBs. A lot of us know someone who bites their nails and can't stop. But that's the most socially acceptable of them all, or at least the most knowledgeable that everyone seems to know about. But people don't know about trichotillomania. People don't know about excoriation disorder, which is skin picking, which is what I have. And the barriers of access, especially from mental health professionals. Like, I've had really bad experiences of being told that I just needed to grow up. That was when I was a teenager. I was told that I just needed to grow up, that the woman, she was a mental health nurse, and she said she had seen many patients do the same thing and they just decided to stop.
Oh.
So apparently I just didn't know how to stop at that, or just didn't want to stop. I mean, I I don't know if I wanted to bring attention to myself, but if so, then yeah, that's a great way of doing it. It's just, there's different ways of bringing attention to yourself than picking at your face. But unfortunately, I've also faced discrimination because in the last 10 years, I've had chronic pain. The first 6 years, nearly 6 years, I had piriformis syndrome and had to go and get a piece of my butt removed in Las Vegas.
Hmm.
And then, yeah, that's a whole other story on its own. And because there was no help available in Nova Scotia, no help available in Canada, no orthopedic surgeon who could do the surgery or even really understood about piriformis syndrome. And it was actually caused because I had fallen on a set of stairs in a different angle, and it lodged my piriformis muscle into my sciatic nerve. The videos online and everything, it's pretty gruesome. Yeah, yeah. It's
Ouch.
there's a page on my skin. There's a page on my skin picking support website, which is skinpickingsupport.com. There is a little tab of my disability advocacy, yeah, and there's a video of it, of the surgery itself. I had to wait so many years to get a diagnosis. I had to wait the first year. I had a doctor pretty much do nothing, and then I had to wait 2 more years because that's how long the referrals took to get to an orthopedic surgeon and pain clinic. Um, and then they couldn't find out what was wrong. And then, of course, you wait like 6 months for MRIs, and MRIs don't show that type of soft tissue damage. So people didn't believe me. They saw my mental health file, and it's like, oh, this chick can't stop picking at her skin. Look at her legs. Yeah, and then she has pain. Mm-mm.
Mm-hmm. Psycho.
Yeah, and it was really, I went to another dark place, and I'm so lucky that I have my husband through it all. I mean,
So you did start dating at one point.
yeah, we started dating 2 years before all of this happened with my physical health. So, and now I'm kind of like, I finally had my last surgery in last yes, November. And I had to go through shockwave therapy for my hip. And finally, I'm at a point where I have very little pain, but all the discrimination, all the mistreatment for the way I look, even though now my scars are healed, I still get people looking at me like professionals, like I'm disgusting. An ER doctor thought I had gonorrhea and I'm like, no, I'm married. And then apparently he did the test anyway, and then they lost it. So, so the discrimination is high, and I can see it being even higher in communities like people of color and people LGBTQ probably face it even higher than I do. I mean, and you think of aspects like criminalization. What do people think of when they see people with marks on their face? They think that they're doing heroin, meth,
Mm-hmm.
opiates, and that was another thing too. Because of the way I looked, getting pain medication when I was in severe pain, it was times where it was like impossible. And so just the way everything just with my chronic pain journey, it would have happened anyway because I was a young female having these severe issues. But on top with the mental health issues on top of it, it was just like no one was going to help me.
Mm-hmm.
And even like the most well-intentioned professionals that I've had have even implied that pains have been in my head, even when the pains have been on the scans, like when it comes to my hip. It's really difficult always being dismissed because of the way I look or just because of my age or even gender. So there's so many factors that it, of just obtaining not just mental health help, but just normal health that I didn't expect, because I knew mental health is a very different type of science than physical health. So I didn't think I was going to go through almost 10 years of misery from all that and have to experience that level of discrimination.
Hmm. So what was it about the skin picking that gave you comfort? I'm assuming it gave you comfort, like it was just.
Oh yeah. Yeah, my skin picking even increased during that time. like when I first had the fall. But overall, what skin picking does is it's a gratifying, a relief type feeling once you engage in the behavior and you achieve whatever goal it is. So if it's like trying to smooth out a part of your skin, or if it's like just pulling an odd hair out that's kind of an ingrown hair, those are it feels really it's like an instant relief. Like there's really nothing comparative to it. Like, I mean, I used to smoke cigarettes, but it was a different type of thing.
It's like picking your nose. You got a booger that's bugging you, and you finally get it out.
No, not quite. There is a body focused repetitive behavior called, and I don't know if I'm pronouncing it correctly, rhinotillomania, and that's compulsive nose picking, where people what something triggers them where they have to continuously pick at it. And I think what I kind of learned through my therapy is it's almost like for some reason people with BFRBs are perceiving whatever they're picking at as a threat to themselves, because anxiety way back in the caveman days was necessary for us to survive. And now that we have all these different things like that are supposed to protect us, like locks on our doors and things like that, and even having like community members to protect us, anxiety has turned more inward so that we don't have to actually physically exert ourselves in the way that we had to way back in those days. And that's like a huge issue when it comes to anxiety. So it kind of clicked for me, like in therapy, like, yeah, when I see something, I immediately, I want to attack it, I want to remove it, even if it means causing a greater mark in response. It's at least it'll be a smooth one, and then it'll scab over, and it's like you don't even care about the consequences at that time. It doesn't matter how much you try on that logical level. You just want it gone because it really is that biologically rooted. Like, you can literally, I've done this lots of times where I've looked in the mirror and I'm like, I'm not going to pick. 2 seconds later, right up there, like it literally can happen just that quickly too. And I think why it's really hard to go into recovery from these disorders or like get rid of them is because the reaction time from us having the trigger to us reacting is boom. So it's like automatic. Whereas if you compare it to an addiction, which again, it's hard to compare, you like say something like alcohol, then you can at least make the decision as you're walking to the kitchen or as you have to drive to the store to pick it up. So the enforcement still has a lot of, procrastination, a lot of come on, let's do, whereas we can just quell it in a second. It's like I could feel like something on my face and then boom, get rid of it, done. So to be able to dissect that is really hard and requires a lot of mindfulness because I mean there are different subsets of picking, and I kind of do both, but one of them is kind of like the deliberate, I want to call it, because I can't think of the word right off, where I look in the mirror, where I would like look in the mirror and pick at myself. And then there's the ones like, for example, some people, I know a lot of people, once in a while I get it, like where you start kind of picking a bit at your fingers. Like I can't have long nails because I'm very sensitive to just the sensory component of long nails. And I'm always going like this, and then I'll start going like this. So I can't have long nails.
It's funny. As you're talking, I'm picking up on things that I do that are maybe considered a BFRB, but for me, it's more of a sensory thing. It's not like an invasive thing. Like I have to get rid of it. It's more like I do this weird clenchy thing. So I push the skin under my nails back. It feels nice,
Yeah.
stuff like that, or even playing with my mustache or whatever. Like, and I will like sometimes I shave my head and I'll pick at the skin on my head. But again, it's like a sensory thing. Yeah, that's about it. I don't know.
That one I would be very worried about in case if you were to do that and then like say something traumatic happened in your life, it could be a way to, as long as you know and you're aware of when you're doing it, I think, because I think there's ways that things can devolve into disorders. Like I've known a few people who've picked a bit and then all of a sudden they got really bad.
To be honest with you, I have a loved one that in high school they had big bald spots where they pulled their hair, they have bad anxiety, and to this day,
Mm.
like I'll give them shit if they're like, hey, if I catch them doing it, and stop it, I see what you're doing. And they're like, ooh, and then they, sometimes they get defensive, like, shut up.
That could unfortunately cause a lot of shame. Like it depends on what your relationship with the person is, like how close you are, and I mean, you have an understanding that this person has tricks, so you have some sort. But even then, if you're close, to have someone telling you to stop it all the time, I think for me was hugely triggering. And
Hmm.
even though I'm in recovery, when COVID started and everyone's like, "Don't touch your face, don't touch your face," and I kept hearing it like on TV, it actually like just upset me because I remember just so many people, it's like infantilizing to tell you like stop picking your face. It's just like
Hmm.
feels like wagging your finger. There are definitely ways to address it if you have that relationship with the person, or at least want to have the conversation with them like, hey, do you want me to let you know when you're doing this, or gentle reminders versus even jokes, because I could tell you joke with a lot of things, as do I, like especially with my husband. um but I think it's really important when it comes to mental health that everyone has their own boundaries. Maybe you've already hashed out your boundaries with this person and or their boundaries, and but that type of thing could be a little bit hurtful, because I know, because that's like the one thing we want to do but can't. So to hear like just stop, it's like, why? You think I've been trying? And it also depends, like if it's more of a habitual pulling or something versus a full on disorder, and also how much it upsets you.
Hello, everyone. I hope you're enjoying the episode so far. And if you're a newer listener to the podcast, I encourage you to listen to some of the older ones. For example, episode 5 with Megan Burstick. In that episode, I speak to Megan about her father, her brother, and 2 sisters that all took their lives at separate occasions and separate points in time. Megan is a wonderful mother and an incredibly strong woman. But for now, back to Angela.
I met someone who had skin picking pretty severe, but when I was speaking with her, she said that she just didn't cover up because she didn't care. No one ever bothered her about it, and I was just kind of thinking like, wow, like how, like really? Because for me that was just like, I felt like I was fresh meat if I didn't have makeup like on my face, just to hide everything.
Hmm. Hmm.
So I found that it's really, so the condition can be worse, but it's how it affects you emotionally that's really the problem. I mean, there's some BFRBs like skin picking that do come with long-term consequences or dangers, including scarring, infection. You can have, I know someone almost had, actually the leader of the Picking Me Foundation, Lauren, she got MRSA and almost had to have her leg amputated. So I mean, there's very serious consequences. I had heard about somebody who had picked their neck down to like their artery, and they didn't hurt it, but it was damaged, and I was just like, wow, like that's, it really, and just to try to stop. And I know another person who developed another type of infection. It wasn't MRSA, I forget what it was, but her face completely blew up and her eyes were swollen, and it was really scary, but what you have to go through. And then of course a lot of people feel embarrassment. Like when I think it was like 2005, when I was in my early 20s, I picked my chins really, really bad. And now my chin is actually like thicker than before, but I don't think most people can tell, but I can tell. I've been able to kind of let it go over the years, but once in a while there's a picture and I'm just like, oh, it looks so round and it wasn't round years ago. And actually wearing a mask, or even like having my husband's stubble touch it, can turn it almost scabby. like there's something weird about the way it healed that it almost rips it open. And even wearing masks, like I don't even have to pick it and it looks like it's picked at just along like my jawline, like from here to here. So there's definitely, and then of course, when you have marks like that, then things start growing in abnormally, and then you want to get rid of those abnormalities on top of the abnormalities, and it can become another cycle of its own.
Mm-hmm. Yeah, I even actually have like acne scarring on my head from when I was a kid, like picking at my zits and that, and but I've not that that's the same, I'm not comparing myself,
Well,
but I don't know.
a lot of people do start getting their excoriation disorder. I mean, mine certainly was exacerbated by acne in like during the teenage years. But a lot of people, even if they pick at it, once the acne's gone, there's nothing left to pick at. But if they're continuing to pick in the absence of a dermatological condition, then it is for sure a mental health condition. And I was actually diagnosed with my legs in grade 12 as having lichen simplex chronicus, and I went through a whole bunch of skin treatments. They were like these chemical baths and just pretty much like free tans. So, and it cleared my legs down really great. But then when I followed up with the dermatologist and my legs were back to what it was, he's like, it's it's a probably something you should see a therapist about.
They diagnosed and treated you for the physical part, but not the mental part. Yeah.
Yeah.
Yeah, I've said on this podcast before that I was diagnosed with a stomach ulcer when I was a kid, but not why I had a stomach ulcer, which was because of the high anxiety. But is thumb sucking a
Yep. I mean, a common childhood BFRB that most kids end up growing out of, but it's totally.
I know I know young adults that like it's like in their teen years and young adults and they're still doing it and
Yep.
yeah. Okay. Interesting.
It's a self-soothing behavior. That's what BFRBs kind of come down to, is that they calm the central nervous system. So there's a lot of things I learned too that generally isn't taught in like therapy about kind of releasing like your energy onto fidget toys and getting that sensory feedback from that. Gosh, there's just like so many things if I compare the therapy that I got in Nova Scotia to the therapy I got from the expert. It's really something. Like when I first started with Karen, I thought it was going to be like we start off like any old therapist, tell me your life story, kind of like today. Let's start from childhood, let's go all the way up. But we didn't start with any of that at all. It was just strictly we started like logging the behaviors and noticing patterns, and then eventually we started to challenge the what's known as the permission giving statement behind what kind of green lights the urge. So what makes me finally go, aha, I'm going to pick it. And so I ended up learning a lot about my cognitive distortions, like how I must pick this, but it's like, no, it's not I must, is I feel like I must. And being able to kind of separate yourself from that instead of just taking it on as your own.
Right. When I was in treatment for addiction, there was a few days where we'd talk about the brain and what's happening when you're drinking or using, and when you're wanting to use, what part of your brain is doing what. And I found that just incredibly helpful, because when you catch yourself, and then it's like, oh, I'm in this phase, my brain's doing this, and this is why it's doing this right now. So, oh, okay, you know what I mean? Like for me, it helped me to.
It's empowering.
Yeah, it is. Yeah, and I think that's something that maybe more treatments should have for different disorders and stuff. It's like, this is biologically what's happening in your brain while you're going through the process, and it's easier to recognize then.
Yeah, that I wish there was that amount of education though behind all these types of things, and that's the problem, especially with BFRBs, trying to get the education behind and any type of research established. Because right now, There's research going on in the United States. There was a research study, I think it was on trichotillomania from Quebec at one point. I may be incorrect about that. But generally, we don't really, as Canadians, focus on mental health or really a lot of innovative health systems, like such as why I had to go to the States to get a piece of my butt removed from a Canadian doctor.
Mm-hmm. Is this sometimes trauma based or trauma inspired?
It can be.
It can be.
Yeah.
Okay.
I think for me, it's kind of like the collaboration of all of it, because another thing that it can be it can also be genetics. Genetics has a huge, I think there was a statistic of 1 in 4 people who have a BFRB, or it could have been just trichotillomania. I really should have a sheet in front of me with all these facts instead of just trying to do it off the top of my head. So, I mean, don't quote me on any of these facts. The 1 in 4 people who had trichotillomania or a BFRB had a family member who also had a BFRB, and I have a few people in my family with BFRBs among my relatives, I'll say.
Mm-hmm.
But and then of course I had trauma of what happened to my father, the brain injury, and how it changed everything in our lives. That was a huge thing. And yeah, I've heard from a lot of other people that trauma can induce it. And really, what was very interesting is I moderate the largest Facebook group about dermatillomania called Dermatillomania Awareness. I think it has like 17,000 now of people. There was something like 12 or 13,000 at the beginning of the pandemic. And then I remember the second lockdown, there was a surge of people, like during the UK lockdown. I remember that second one. There was a surge of people requesting to join Dermatillomania Awareness. And one of the questions that we ask as moderators is, how did you learn about this? And people were just organically looking it up. They're like, I just looked it up for my own. It wasn't an article. It wasn't anything. So I think, and there were people that have made posts like, "Hey, I'm starting to compulsively pick at my skin because of all these lockdowns, and I don't know what to do." So there's a lot of things that can contribute to somebody developing a BFRB, especially if they're already genetically predisposed.
So after 2009, when you wrote your book, did more people kind of come forward and reach out to you, and
Yeah,
yeah, like doctors too, or just other people that?
I've had a couple therapists, yeah, reach out to me. I have a few therapists that have followed me for years in the United States, of course. I don't know, there's a bit of a complacency, I think, in Canadian healthcare that's different than America. Well, not to say that America's is the best, but I mean, there's pros and cons of each.
Mm-hmm.
Um, yeah, a lot of people reached out, and it was overwhelming because I didn't expect it. Like at the time I released my book, like there was only like that one nonprofit. It was still Trichotillomania Learning Center. No one had in the world had come out with this, so it was just kind of, I didn't know how many people had it and what type of feedback I would receive. And I got so many messages that it really did become overwhelming. I was like, what did I actually sign up for here? Like, I want to do this, but oh my gosh, like people are just pouring their hearts out to me, and I don't, it's hard to have that time and like the energy really to get, like when people just like write their whole life story back to you because they've read your life story.
Yeah.
It's really, it's the biggest gift though of being an advocate, is that I've had a lot of people trust me with very personal things, from abuse to other mental health disorders, and I really don't take that for granted, because it's a lot of times people are saying things that they also haven't said for the first time or to relate to anybody else. And just to eliminate that type of shame and to open up a conversation, whatever the issue is with that person, I'm really glad to be a part of and to be entrusted with that.
Mm-hmm. But I've been in that same role a little bit, but sometimes it's also a little overwhelming, and you need to set boundaries and stuff too, because it's like, oh God, you want to try to save the world and take it on other people's traumas and pains. But yeah, it is very humbling actually. It's nice, but depends what state I'm in.
Yeah.
how it feels. But yeah,
There's really something about that honest, raw human connection when people are able to really confide in you about that. And yeah, if being a sensitive person, it really is overwhelming to just like, how can I write back that doesn't make me sound stupid or dismissive of everything you just wrote. And it's those types of thoughts going through my head, which just makes it even worse.
You said you were on the show The Doctors in 2015, so that was a 6-year span between your book and finding a professional that seemed to actually started helping you. So
Yeah.
Those 6 years, you were still
advocating. I was doing news interviews. I even had like a Japanese reenactment done of my life story.
Amazing.
Oh yeah, that was something. So I got contacted by so many different outlets before I got contacted by the doctors, and I had been working on the documentary Scars of Shame, which was released in 2015. It was recorded a year and 2 years before I became physically disabled. But yeah, so during that time, like, I just decided to live how I was going to live. I tried a medication in 2011, or it's a dietary supplement called NAC, N-acetylcysteine.
Obviously.
Gosh, I don't know if I pronounced. Yeah, so NAC. But it's had a lot of studies done, especially by the top researcher, Dr. John E. Grant, for skin picking and trichotillomania. And so I tried a bit of that. I had some short-term success, but I ended up coming off it. It gave me a kidney stone because I didn't take enough vitamin C. I didn't take vitamin C supplements like I was supposed to with it. But really, I would like max out the dosage, and then it would stop. It worked a bit, not a lot, but I mean, it worked enough that it was great, but not enough for the side effects of it and the cost of it at the time. So I was like, this isn't a long-term solution to just keep taking this, dietary and supplement. I don't know what the long-term consequences of taking it at this high of a dose even would be.
So it's more than just anxiety. Like, it's not just let's help her with anxiety and give her tools and then that'll stop the picking. There's actually more to it than that, because it's obsessive is it
Mm-hmm.
a little obsessive compulsive too?
Yes. So in the DSM-5 BFRBs, it's not called BFRBs like officially, but they're all categorized under the obsessive compulsive and related disorders category. So in the DSM-5, which was released in May of 2013, that was the first time skin picking was mentioned. It had been mentioned in the DSM-4 as a possible symptom of an impulsive or an impulse control disorder, but trichotillomania was in the DSM-4. So there's a lot of studies that need to be done. I mean, it's been 9 years, but to catch up with all the studies and being able to get volunteers for research, I mean, there's a lot more that needs to be done in order to figure things out about this disorder. But CBT, the therapy I got was a combination of CBT and ACT, which is cognitive behavioral therapy, and acceptance commitment therapy, and it was 12 weeks. So in our therapy, instead of talking about like my childhood and everything, we went straight to dealing with the compulsions itself. Like, doesn't matter where you come from, like, we're dealing with this. It's not about what happened that could have triggered you in your childhood. It's dealing with the actual behavior. And as I dealt with the behavior, there were things that came up for me. Like, I was thinking more about my dad and the effect his brain injury had on me, and things like how unfair it was that he is still and has been disabled for like 25 years. And some of these things too, like my dad's brain injury, like I haven't talked about that in like so long. So even like talking about it again is just like, like wow, it happened, instead of just, I see my dad when I go to my parents' house and stuff, and he doesn't talk a lot. He sits in a chair and watches TV, but it, it's still just talking about it is difficult because it's probably one wound that I don't think will ever really get healed.
Mm-hmm. Yeah. If are you do you have like scabs on your skin now, or are you pretty much have so much, you've been through so much treatment stuff that it doesn't get to that point anymore?
Oh, it totally does. Like, I actually got COVID back in April, and my face picking was worse than it has been in the last 7 years since I was in recovery because I have had so many circumstances, like still trying to recover from my hip surgery, taking care of a 2-year-old,
Mm.
not being, which meant not getting outside help. And me and my husband were both hit hard by COVID. I had a migraine for 9 days on top of my hip issue, and then being locked in the house with a 2-year-old, and so the stress levels were certainly challenged that. But I think getting treatment for excoriation disorders, like getting treatment for any other mental health condition, it's more of a management. Like you can go into a state of recovery and then slowly kind of trickle out. And like I know from times where I've experienced depression and then have been out of it and then trickle a little bit back into it, it kind of feels like the same thing. So I mean, I guess to describe it better is that the compulsion part of my disorder is mostly managed, but I still have the obsessions. Like if I look and go to the mirror and look, I just like, okay, well, what do my eyebrows look like? That's like a really big trigger for me. Like my eyebrows, they're completely scarred. Like it looks so textured when I put makeup on. I don't wear makeup much anymore. I just for fancy events like this.
Mm. Same here.
um, yeah, you look darling. So yeah, there's definitely like scarring. I have scars. They're mostly hypopigmented at this point. Um, actually, I love as much as some like doctors and healthcare professionals. Like I've gotten more discrimination from them than the average person. Like the more time, like I've been looked at, like I've been like I'm really disgusting. Like even just for the white marks, and I love them because I never thought they were going to be there. I thought they were always going to be red, ripped, and open. So I don't want any sort of like scar revision or anything. I'm good with having all these white dots, even if it means looking different. Sadly, it means, still being looked at kind of gross or whatever by some pretty arrogant people, but it's more of a reflection on them.
Hmm. Um, Now I can't remember if I Googled you, and I can't remember if it was online or if it was part of our initial email that you sent. But yeah, I mean, you had scabs like every inch to 2 inches all over your face and all over your chest, and so I mean, yeah, and I mean scabs that were half inch big to an inch big, and so um, it's
And
nice.
they got regularly infected. I would need to go to the doctor to get just regular antibiotics of just normal infections, staph infections. Luckily, nothing that got out of control other than what happened with my chin. But yeah, like I was covered. It was mostly my legs. Like I'm going to be posting something during BFRB Awareness Week, October 1st to 7th, and it's going to be a picture from 2007 where my legs are sleeved with compulsive skin picking, and that was the
Hmm.
year that I was at my worst, like 8 hours a night. But now, not that it's hard to raise, but I
Woo
mean, these are my
woo.
legs now, and it's been like that for 7 years. So I can wear shorts again. I can wear, and it's not to say people who don't have clear legs can't, but
Yeah.
I certainly feel more comfortable being able to, even if people are more rude versus if they were rude before. I don't know if it's still like an element of shame that I held just because it was something that I couldn't stop, but now I have more power and it's something that I stopped. And it's like, you're making fun of my scat or my scars. Like, you have no idea what these looked like before
Yeah.
type deal. So,
Right.
I'm more proud of them, and just like, because I never expected it would happen.
The awareness week. Is there what else happens in like explain the awareness week, October 1st to 7th, like what?
So BFRB Awareness Week is just another, there's awareness weeks for everything, or awareness days for everything. And so BFRB Awareness Week is a way to raise awareness for body focused repetitive behaviors, what they are, including the whole list of them, which you can find at my website, skinpickingsupport.com. There are nonprofit organizations that often, I'm pretty sure they're all going to do BFRB week events, and that would be the TLC Foundation for BFRBs, the Canadian BFRB Support Network based in Toronto, and the Picking Me Foundation, which is more skin picking based than BFRB based. But I also have some BFRB week events available at Skin Picking Support. I'm going to be having, and I run the group meetings for skin picking support once a month, and on a Saturday, one Saturday a month. Say, yeah. So the one that we're having on October 1st is going to be Smashing Stigma, and there's also some writing opportunities, some blog opportunities about BFRB awareness that people can get involved with if they want to check out the Skin Picking Support Instagram for more information. And one of the writing assignments is, what does BFRB week mean to you? And I'm really excited to hear what people's responses are, because there's been a lot of advocates over the years with various BFRBs raising awareness, being featured in magazines, on television. I love being able to see everybody else doing the work that I've been doing too. And it's really amazing to see everybody come together during BFRB week again, to just kind of just scream it out to the world, I guess, that we exist, and here's the struggles, and we need your help, we need your awareness, because I mean, loved ones struggle with it. They don't know how to react to it a lot of the times, whether it's the parent of someone who has a BFRB, or maybe a grandparent, like even teachers. I mean, pretty much everyone needs to know about this and be able to find ways to accommodate to an individual's needs who has this disorder, and or to at least understand what they're going through, and know what their boundaries are related to the disorder.
And we're gonna air this episode during that week too to help that out. So that'll be good, I guess.
I really appreciate that.
Oh no, my pleasure. So when did this awareness week start? Because you were saying in 2009 there was only the Trichomania. I can't say that.
Trichotillomania Learning Center. I can't give an exact year, but I think it's because, I mean, you got to think too of like when social media really kind of brought all these different awareness weeks, campaigns, and stuff to life. I keep thinking it may have been around like 2012 or 2013 that TLC was doing it. CBSN, I think they launched in 2013, but I don't think they waited a few years, I think, before doing some. And now there's just a whole bunch of people doing it. And there's others, like other grassroots organizations as well, working on BFRB week events. So I'm actually, I don't know what anyone else has planned, so I'm excited to see. If I happen to be the only one who has something planned, then
so be it.
Then I guess Then I guess everyone's going to have to go to skinpickingsupport.com and check us out on Instagram, or join our support group on Facebook.
So you're a bit of a pioneer in this advocacy role. If there wasn't a whole lot of stuff out there when you started writing a book about it, so you should be proud of that, if nothing else.
That term's very strong, but thank you. It's not the first time I've heard it, but like when I hear things like that, it's like I live these two different lives. I live the life as someone who's like, not probably lower class, someone who grew up lower class, who has scars on her face. She goes to the doctor, gets ignored, gets treated like crap. That's me here in Nova Scotia. But then there's people who think differently of me in other areas based on what they've learned about my life and my story and advocacy. And it's like completely two different parallels. Like the last time I was able to go to a TLC conference, the way people like talk to me and stuff, like there's so much respect, there's so much admiration. And it's like here in Nova Scotia, and like, nope. So so it's really difficult, like when because I feel like, my everyday life is here as I am, as a person, as a mom, as a wife, as someone who's struggling with chronic pain and trying to rehabilitate from that, and then of course trying to still manage my own urges along with other mental health kind of related issues as well, like depression, anxiety, some issues related to that, and definitely trauma.
Mention real quick, and anything you want to plug, your book, your documentary, and any social media you want.
So I have a book called Forever Marked, a Dermatillomania Diary, that I released in 2009. And the documentary Scars of Shame was released in 2015, which was the same year that I appeared on The Doctors, the American talk show. And I ended up getting treatment from Karen Pickett in a 12-week program of CBT and ACT. Grateful for the help that I was able to receive. And I continue my advocacy through Skin Picking Support. And the website is www.skinpickingsupport.com. And I run a support group on Facebook called Skin Picking Support. And we have monthly peer-led meetings, and they're led by me. And definitely, if you want to use the hashtag BFRB week during October 1st to 7th, that would be really amazing to help raise awareness with the community.
Thank you so much, Angela. I very much appreciate all the information and you telling your story, and reaching out and helping others. It's awesome. That's exactly what this whole podcast is for. So thank you again. I very much appreciate it. Once again, if you're in Melfort, Saskatchewan, October 13th, I believe that's a Thursday, you can come see me. I'll be on a panel, and I'll be doing some speaking for the youths of Melfort and area. It's a mental health symposium, and you can check that out at youthmatter.ca/events. I'm not sure if it's all sold out yet or not, but you can just check it out. Another thing, at that same website at youthmatter.ca, every Tuesday night there is a youth mental health talk. They have special guests, and you can go online and log into that and have the youths of your family or friends to listen to that and get some good information on mental health. Don't forget to tune in next week, where I'll be talking to Donna. She's the mother of Gia, who was on the television show The Bachelor, who took her own life and suffered from PMDD. I thank you so much for listening, and I want you to not forget to make your beds and take your meds. Bye.